Let's take a look at the interesting history of the drug LDopa, also called LDopa. LDopa is a medication used to treat individuals who have Parkinson's disease. Parkinson's disease causes people to have problems with balance, muscle control, and movement control. The symptoms are tremors, involuntary movements, and muscle spasms, which are also called dystonia. Also, there are cognitive problems and language comprehension issues. The condition is progressive and incurable. The average age of a new Parkinson's disease patient is 60 years, but it can occur in younger people and much older people. There are about 1 million people living in the U.S. today with it, and there are about 50,000 new cases each year. The lifetime risk is higher for men than women. There appears to be a genetic component in maybe 15 to 25% of cases, but there is perhaps environmental causes such as exposure to pesticides, and there has been a connection between the occupation that one has and their chances of developing Parkinson's disease. Physicians and teachers appear to be among the highest rate of people developing Parkinson's disease, and it's not well understood why this is. Parkinson's disease is caused by the degeneration of dopamine-producing neurons in an area of the basal ganglia called the substantia nigra. By the time a person is beginning to show the first symptoms of Parkinson's disease, only 30% of the dopamine-producing neurons in that region of the brain is left, suggesting that we are all carrying around extra dopamine neurons in that area. Michael J. Fox, the actor, was diagnosed with Parkinson's disease when he was only 29 years old. He started a foundation to raise money for research. Drug treatment for Parkinson's disease is focused on getting more dopamine into the brain. When you think about increasing the level of a neurotransmitter, how do we do it? It can be very difficult. For example, dopamine does not cross the blood-brain barrier, so taking dopamine in pill form or even being injected with it will not get the dopamine into the brain. Our bodies make dopamine from composite ingredients, including tyrosine, which gets turned into LDopa, which then gets turned into dopamine. So, where does the tyrosine come from? We get tyrosine from the foods that we eat, and it's in many foods. For the person with Parkinson's disease, it's not possible to boost your level of dopamine enough to make a difference by just increasing the amount of tyrosine-rich foods that you eat. Unlike dopamine, LDopa can pass the blood-brain barrier, so giving patients LDopa as a medication successfully increases the amount of dopamine in the body because LDopa gets turned into dopamine through an enzyme reaction. A treatment for Parkinson's disease was discovered in the 1950s by Swedish scientist Arvid Carlsson. The drug is called levodopa, or LDopa for short. LDopa continues today to be one of the first-line treatments for Parkinson's disease. Drug tolerance refers to the fact that the body will need more and more of the drug to have the same effect as it did initially. For example, if it took 10 milligrams of LDopa to control a Parkinson's patient's tremors, after 4 to 6 months, it might then take more of the LDopa to have the same effect, maybe 20 milligrams or 40 milligrams, and the amount that it would take moving into the future would continue to increase. The drug LDopa and the problem with tolerance of LDopa is part of the story in the film Awakenings. starring Robert De Niro and Robin Williams. It's based on a true story written by the neurologist Oliver Sacks about patients who suffered from a type of encephalitis causing immobility. L-Dopa was given, and these people woke up and started to lead normal lives. But slowly, the tolerance to L-Dopa built up, and it became no longer practical to be giving such large amounts of the drug. So the drug had to be withdrawn, and the patients went back into their immobile lives. It's somewhat of a sad ending. If you haven't seen the film, it's definitely worth checking out. For individuals with Parkinson's disease for which drug therapy no longer works, the recommended treatment is something that you might find quite extreme. It's called deep brain stimulation, or DBS. Surgeons place electrodes permanently inside the area of the basal ganglia that's degenerated. That's the substantia nigra region. And the electrodes then can be controlled by an external pulse generator on the outside of the body. It's like an on and off switch. With the proper adjustment, a person with Parkinson's can actually be free of the uncontrollable tremors for quite a long period of time. But it is the case that DBS may eventually also stop working completely. Drug tolerance also occurs in drug addiction. For example, opioids. A person who is addicted to opioids will need more and more of the drug to maintain the same level of a high. In someone who's been addicted for a long time, they may need to take very large amounts of the drug just to prevent themselves from feeling physically ill. At this period of the addiction, if people do not take large amounts of the drug, they're actually going into withdrawal. So the flu-like symptoms, the feeling very sick, is part of the withdrawal process. There is a relationship between tolerance and overdosing. The risk of overdose is high following a period of abstinence from the drug. A person will have abstained from the drug for a period of time, and during that time the brain has gone back. Remember brain plasticity, and the number of receptors then now has increased for that particular drug. So then a relapse happens, and the person takes the same amount of drug that they took at the height of their addiction when their tolerance was very high, so they had to take a lot of the drug to get the same effect. But when they take that same amount now, after a period of abstinence, it's too much for the body to take, and an overdose occurs. If you know someone who's struggling with alcohol addiction, there is a national helpline that can provide some assistance. That's all for now.